This is Dr. Mayura, and I want to talk about how you need to get on a path to a healthier you by quitting smoking right now. So instead of looking at smoking negatively, for example, oh no, I have to quit tomorrow, I have to stop smoking my cigarette, using all that willpower, why don't you think of it positively? The benefits you're going to get from quitting smoking. When you look at something positively and it benefits you, it's always long term. Instead of something, instead of whining about it, saying, hey, I don't want to quit, but I have to stop my cigarettes. Do an exercise. Write down 5 points, and each point is why quitting smoking will benefit you. And they can be small. For example, if I quit smoking, I'll save approximately $2,300 a year, and maybe I can use that for my family. Maybe I can use that to invest in a company. I can use it to shop, to buy things I like. So each pack of cigarettes is approximately $6, and one pack a day for 365 days is more than $2,000. Now that's a lot of money. 2, maybe my breath will smell better and my girlfriend will want to kiss me, right? Maybe I can kiss my son and my daughter without going and brushing my teeth every second minute. Point number 3, maybe when I exercise, I'll feel fitter, stronger, and I can run longer, and I'll be more powerful. Point number 4, maybe I can make my son and daughter and my mom and my elderly parents proud of me. And point number 5, maybe I'll look younger, because it's proven that smokers look 1.4 times older than non-smokers. It's an anti-aging solution. Instead of using all those creams, just stop smoking. So you can use it as a vanity issue. So I'm just giving you 5 examples why, stopping smoking will motivate you. Of course, we do all know the health benefits. Right? Tobacco smoke has more than 7,000 chemicals, and more than 70 of those are carcinogenic. And some of those chemicals are carbon monoxide, nicotine, arsenic, lead, formaldehyde, ammonia, and I can go on. So do you want to put these things in your body? I don't think you do. But again, smoking is an addiction, and it's not your fault. You're not weaker. Your nicotine has just hijacked your brain. So, you can come out of it. You can absolutely rewire your brain to come out of it and have a healthy amount of reward without using cigarettes. So let's start. After your last cigarette, what happens to your body? That's a very interesting question, right? So 20 minutes after your last cigarette, your pulse rate comes back to normal. So that's just 20 minutes after your last cigarette. You're already helping yourself. Now, 8 hours after your last cigarette, your oxygen level increases, and your nicotine and your carbon monoxide and nicotine levels are starting to decrease in your blood. So they decrease about 50% in 8 hours. Significant. What happens after 1 day? After 1 day, your BP starts to come down to normal. It starts to decrease, and your risk of heart attack starts to decrease. By 1 day, your risk of heart attack starts to decrease. That is significant. Am I right? So what happens in 2 days? So in 2 days, your nicotine level has drastically reduced. Your cravings your withdrawal is going to start up. You're going to feel irritable. You're going to get headaches. You're going to feel angry, and you're going to feel anxious. So you need to know this, prepare yourself for this, and have outs for this, things that you can do while you're feeling these things, these withdrawals. You will have increase in taste and smell by 48 hours, because the nicotine in the cigarettes, it hampers your taste and your the nerve endings to help for taste and smell. By 72 hours, which is 3 days, your nicotine level in your blood is 0. So you have no more nicotine in your blood. There will be more cravings. There will be more withdrawal at that point. You need to be ready for that, either by nicotine replacement or your medications or activities that you're doing to distract yourself in those periods of time. Your lung relaxes at this time, and your breathing improves. You will noticeably see an improvement in your breathing. 5 to 10 days, there will be a reduction in cravings, and you will start to feel better. In 2 to 12 weeks, you'll have less coughing and shortness of breath, and your circulation will start improving, and your withdrawal should have ended by now. Now, one thing I want to add is coughing after you stop smoking is not bad. It is actually a good thing. because it's showing that you're removing all the foreign particles in your. It's just a mechanism where the body is cleaning itself. So it's not a bad thing if you're still coughing after you stop smoking. All right. 3 to 9 months. So your lung function improves drastically, your immunity improves drastically, your respiratory infections reduce, and your cilia start improving and almost heal. They heal at 1 year. At 1 year, your heart attack rate has reduced up to 50% compared to a smoker. So this 1 year mark is significant for you. 50% reduction is a lot. After 5 years, your stroke rate has decreased significantly and your arteries and blood vessels have started to widen. After 10 years, your risk of lung cancer has reduced by 50% as compared to a smoker. Huge. Also, your risk of throat, esophageal, pancreatic, and cervical and bladder cancer has reduced significantly. So smoking causes more than 12 cancers, and you want to be able to reduce this, and probably more than that, but that's what we know now. So that's the 10-year mark. The 15-year mark, your risk of heart disease has reduced to that of a non-smoker. Huge. And by 20 years, all your risk of smoking-related comorbidities has reduced to that of a non-smoker, especially in females. So keep that in mind. By 20 years, you are back to square one. So don't think of 20 years, but think of the next 20 minutes, you're helping yourself. Think of the next 8 hours. Think of the next 24 hours and 48 hours. You're doing so much to your body. You're improving every 10, 15 minutes. So this is the quick effects of nicotine in your blood and how you're withdrawing and how it's going to benefit your health. Let me quickly go over things that you can do to treatment modalities. Now discuss this with your physician and see what's apt and good for you. There are nicotine replacement therapy. So you can put a small amount of nicotine in your bloodstream by lozenges, gum or patches, etc. And then that will deliver small doses to you. Or whenever you have a craving, gum, it'll deliver small doses. So your withdrawal symptoms reduce until your body learns to live without craving nicotine. Also, you have two drugs, varenicline and bupropion. Varenicline is called Champix, and it acts on the nicotine receptors in the brain and it reduces craving. It also reduces withdrawal symptoms. Now, this drug you would have to take about maybe 2 weeks or 1 month before you stop smoking, and that's how before your quit date. So ask your doctor, because there's some interactions where some people can't take it, so you need to figure that out with your doctor. Bupropion is it's called Wellbutrin, the brand name in US. It is an antidepressant, and it was used as an antidepressant, still is. And when people use it, they notice decrease in craving for cigarettes. So then people said, hey, it might help in actual cessation for smoking therapy. So that again is taken about 1 week before your quit date, and the dose has to be monitored, and and your doctor will tell you how to take those things. So keep in mind there are a lot of modalities to use to stop smoking. Also use your those 5 points you've written that will motivate you on a daily basis. There's a beautiful quote that says that people often say that motivation doesn't last. Well, neither does bathing. That's why we need to do it regularly. So motivation is like a muscle, and you need to keep motivating yourself every single day by reading these points and whatever motivates you. And that's how you're going to stop smoking on the long term and for once and for all. Even if you have relapses, it does not mean you're not going to stop smoking. So let that not deter you from trying to stop smoking. Relapses are part and parcel of stopping smoking. It does not mean that you're weak. It does not mean that you will never do it. So keep going, and you will be able to get back to tip-top shape. Thank you so much. If you have any questions, let me know.